It's a hard moment for the Kenyans whose majority are struggling to put food on the table. As the number of the coronavirus patients shoots, Kenyans are living in despair and thinking very hard on whether the deadly coronavirus shall spread further and follow the route of Italy, USA and other superpower nations which are overwhelmed in containing the virus.
And we are seeing a scenario which no one has ever envisioned in the globe. And it's coming with a very high impact on our mental wellness, largely because, one, our sources of income are grinding to a halt. Very many people actually are not sure when their next paycheck is going to come. That's a true reality. There's the reality of being in isolation, being in the house in a small space, without being able to socialize, knowing that we are social beings as human beings. There's that challenge of just being there on your own. There's a challenge with the people who live with mental illness themselves. Being cocooned and being in a space of uncertainty can come also with a lot of challenges when it comes to our mental wellness.
Sylvia Kasanga, who is a mental health expert, says the coronavirus crisis and the restrictive measures that many countries are taking to contain the outbreak can have a negative impact on people's mental health and well-being.
Let's also not forget the fact that there's so much information we are being bombarded with. So much information with all the social media. And every time you go to the social media, you raise your anxiety levels, and that can cause you a lot of anxiety and distress and stress. And stress can lead to even depression and many other things. So we are seeing a scenario where we are all actually very vulnerable when it comes to mental health. And we need to be aware of the situation that we are in so that we know how then to mitigate the issues that we are going to be encountering in the next few months as we wait for the situation to unfold.
The most worried lot are the coastal people, where Kilifi County Deputy Governor Gideon Saburi is said to have mingled with the thousands of the residents.
We also know our health system, the capacity is not there. These are facts, these are true scenarios. And what the government then should be telling Kenyans more and more is the fact that we only have X number of beds to deal with only the ones who are going to be extremely, extremely unwell. The rest of you have to learn to take care of yourselves. How do you take care of yourselves? What are the symptoms if you should see them? At what point then should you go to hospital when you know that then you're critical?
Almost more than 60 people interacted with the Catholic priest who tested positive for the coronavirus in Unguja, in Isaiah County and Nairobi are awarded Lord.
It is very hard. We are social beings. It is not an easy thing. I would never wish it upon any of my enemies that they would be in a self-quarantine situation for 14 days. It is very, very, very tough. Because even for those who are even in a home and in a family, and you yourself are exposed, you're supposed to sit in your bedroom, for instance, and stay there. It is not easy. It is calling upon us as human beings now to think beyond what we are used to.
This was the picture at the coast, where the police officers roughed up the residents who are said to have violated the orders. They are the Kenyans living hand to mouth and striving so hard to earn a living. Part of the mandatory requirements imposed to the suspect of the coronavirus cases include being quarantined for 14 days in isolation. For many say living in the self-quarantine and social distancing from the family, friends and the co-workers is one of the biggest hurdles. Reporting for Upsurge TV, I'm Jeff Haemba.